So as I introduce myself, I'm just going to hand over to Roger to introduce himself and go for it, Rog.
Hi everybody. Roger Harrison. I'm part of the Training Hub team, so I'm supporting the event today with the recording, etc. Thanks.
Lily.
Hi, Lily Dixon. I am the FCP education lead for the Training Hub.
Helen.
Hi everyone, my name's Helen Ireland. I'm the pharmacy workforce lead for the ICB. Good to be here.
Thank you. And Mary.
Hi everyone, good afternoon. Lovely to see everybody on the call. My name's Mary Carter and I am the Pharmacy Education Project Lead at the BNSSG Training Hub.
Great. The other person that may attend, may not be able to attend is Ali, who is the community pharmacy lead. And so we'll see if she can turn up, that'd be brilliant. But if not, she knows that this is happening. We know that everyone's probably going to be eating. Very happy for people to keep their cameras off if that's what they feel they need to do. But obviously, the more faces we see of your beautiful faces, the better it will be for us. Otherwise, we have to look at our own, which is a bit sad, to be fair. But if you can put your cameras on, we'd really appreciate it just to help with the engagement. So we've introduced ourselves. So the next bit on the agenda, we're going to get Lily is going to come in and she's going to talk to you about the survey that she performed in general practice, and she's going to tell you all about the survey. Thanks, Lily. You're on mute, my lovely.
Thank you. Sorry, it wouldn't let me do 20 things at once. 2 seconds. I'm going to try and upload it from my computer to make it a bit easier. Hopefully that's uploading.
Yeah, we can see that.
Perfect. So, as I've already introduced myself, my name is Lily Dixon and I'm the FCP education lead for the Training Hub, and that's mainly covering all allied health professionals or paramedics, podiatrists, physios, OTs and dietitians going into primary care. I was tasked with kind of reviewing actually all independent prescribers within BNSSG, including all our independent prescribers, not just limited to allied health professionals, because actually, interestingly, the ICB don't keep a register of where they are, and there's no real policies for independent prescribers. So I undertook a survey to scope where everybody was, who were qualified independent prescribers, who were due to qualify. And I also wanted to kind of review actually what are the issues and CPD requirements for those as independent prescribers, and also looking at where all DPPs and or DPSs were, because if we want to improve and support or upcoming independent prescribers, we need to know where individuals are and who wants to be a DPPS or DPS. So from the survey, we got 110 replies, which is pretty good, actually, considering our total staff is around 337 that we have on our emailing list. That includes our pharmacists or nurses and our AHPs. So we're kind of just under 50% actually are independent prescribers. So I think we managed to capture near enough most of them, which is brilliant. And as you can see, actually, quite good numbers here. The numbers on the side are very much who we have working within BNSSG, what we estimate to be working in general practice. And these are kind of the list of all independent prescribers. So nurses being our largest cohort, followed by or pharmacists or paramedics and physiotherapists. So we have a good mix, a good reply. And we actually have independent prescribers across all our PCNs, which is fantastic as well. So one of the key questions I wanted to look at is actually who is a DPP and a DPS, so designated prescribing practitioner, prescribing supervisor, and it's quite small. So as you can see, 15 individuals are registered or have been DPPs and have been DPSs, but actually we've got 68 individuals who have never been a DPP or DPS who really want to become one, which is fantastic. But to do that, they want support. So we've actually got huge numbers who want to become DPSs and DPPs, which is great. The next thing we kind of looked at is about auditing. We all know that self-auditing, we need to do it annually, but we're aware that actually individuals don't do it. And rather than kind of chastising why you're not doing it, is wanted to look at why you weren't doing it and what were the issues around that. So quite a large proportion of our individuals weren't auditing their practice, as you can see. So 32%, 41% actually unsure if their work was auditing them. 69% were definitely not self-auditing. So very large numbers. And the concerns that came out of this was very much they don't know how. Don't know what frameworks to be using. There's not much guidance out there. They don't know how to do an audit, what the process is and what they should be doing. So we can't expect people to do something if they don't know how. We had a few PCNs who were really good at auditing their workers, but you know, they weren't advised actually they were being audited. So it's not very useful for your CPD if you don't know what the outcome of that auditing is. Auditing needs to have, it is part of self reflection and good practice. And if you don't know the outcomes of the audit, how are you going to improve? So this is very short and sweet. So from doing the self audit, finding where our this survey and finding where our independent prescribers, the questions were around kind of the CPD and what we can do. And you can see this is the kind of the key areas that individuals wanted to know, wanted some support with. So regular updates around independent prescribing, some CPD around it, community of practice, that was a big thing, and peer support. We don't really have anything like that at the moment, and some clear guidance and policies to help support with auditing and actually how to become a DPP and DPS. So what my plan is from this is that I'm in the middle of producing a audit guide that's going to reflect the Royal College GP one and how to actually produce an audit from EMIS, so you can do it yourself, and then what to do with that information. So that's kind of part one, and hopefully we'll have that out before the end of the year. And then on from that is kind of start developing some support to help develop those individuals who want to be DPPs and DPSs. Because we need to support the future workforce. And as part of that as well is developing a community practice, which this is the start of. So it's kind of a community practice is very much what you want. And so we need to hear from you what you want from these community practices. You know, we've got some versions from our survey, but it's really important that you tell us what you need, because community practices are only useful when you're getting something out of them. So you need to let us know. Thank you. Has anybody got any questions on that? So that's very long, very short and fast.
Well, not as such, but that's a clear message you got across. But you were saying that people don't audit themselves. I'm one of them. Well, I haven't been a prescriber for that long, but I have no idea where to start.
Exactly.
They don't really. So are we gonna? Sorry, I missed the first 5 minutes of the meeting. I've said this, but so is this where we get some guidance on that, or?
Yeah, so my plan, I'm just in the middle of finishing up a guide on how to literally set up an audit on EMIS. Now, you might have some of your IT admin team who can do this, or your pharmacy team are actually pretty good at this as well, but not everybody is aware of how to create an audit. So I'm producing a guide on how you can personally create an audit on EMIS. That will run annually. So you just need to press one button once it's set up and it will run it annually. And then what to do with those prescriptions and how to audit it. So I will be putting that guide together for you. And then hopefully this will be the start of a process to kind of start developing a bit of guidance and policy. Because we're well aware people aren't auditing because they don't know how. And lots of stuff that's out there is either not clear or it's very aimed at secondary care and not primary care.
Just to follow up, I've put the poll in the chat where you just so what would you like to see on the agenda? Pop your answer, submit it. It'll come up as a word cloud when we're ready, and it's just valuable information we can take from it. So, Renuka.
Sorry. Hi there. Lovely. Thank you. Thanks, Lily. Thanks, Kerry. I think this is really good. Can I just go back to the DPP DPS discussion in
Yeah.
that? So interestingly, UE, and I know they're not the only providers, but they actually run an information sort of come training session. Is that what you were thinking of or were you thinking of more support for DPS, DPPs? What was there a gap? Basically, what I'm thinking, because the criteria is clear.
Yeah, so the issue is that absolutely been speaking with UE and Plymouth about they do provide support for DPPs and DPS, but it's that first step of people putting their name forward. So they only tend to get that support if they've put their name forward and they're planning to be one. And the issue is actually, you know, people starting to think about it, but they don't want to put their name forward on that paperwork yet. So we need to support them and just kind of a bit of education around what it entails.
Thanks,
Okay,
Lily.
yeah, that's clear. Thank you.
Yeah.
Thank you, everyone. Yeah, keep going, keep submitting your responses, please. That would be really helpful, and we can share it at the end. Interest of time, the reason why we purposely put these just for half an hour is purely because the first one we wanted to make sure that there was, you know, gauge what everyone wanted, and then we can decide on timings a bit later. But I'm mindful of time. Carol, you've got your hand up. Please come in with a quick question, then we'll hand over to Helen.
Yeah, hi Lily. It's just obviously for those of us that work in out of hours and don't work within EMIS for the prescribing, is there anything for auditing in that way?
So that would be down to BRISDOC should have their own policy in place for auditing. Certainly they can absolutely use what I put together if they want to, but they should have their own policy. This is very much aimed at general practice because they're all individual business and they don't have their own thing. But BRISDOC should, but Renuka can hopefully talk to you about that after.
Lovely.
We'll leave you to take that outside with Renuka or Carol, if that's all right. Helen, do you want to pop in now, and then you can give us an update with regards to the ICS?
Thank you. Brilliant. So hopefully you can all see that on the screen. I've just got 2 slides to share with you. And first, just want to start with a thanks to the Training Hub team for taking this forward and for setting up the meeting and cascading, because really this idea of the community of practice really fits with what we're trying to achieve as in a system, in terms of really bringing together people, bringing and enabling the workforce to develop across systems, trying to build those strong networks, and also bring some standardization and training across the different professions and different sectors of care. We have the Healthier Together, so our BNSSG work vision, which talks about things like community of practice. And hopefully together through these networks, we'll be able to help and work towards our health and care strategy and all the needs that we need to help our populations and our communities across across BNSSG. So in terms of pharmacy, I just want to highlight Ali. Ali's come into the space now, and she's our community pharmacy lead. Some of you may know Ali. She's working really hard to increase our independent prescribing and also on our Pathfinder sites, which are prescribing services within community pharmacy. As I say, I'm the workforce lead for the ICB, and I'm really keen to promote the development of our trainee pharmacists, our trainee pharmacy technicians, and also work in the post-registration development. So it's really lovely to see some pharmacists I know from previous years in this space working in general practice and community pharmacy. So I'm going to pause there and hopefully that's been a bit of an intro into what we as a system, why we're excited about today in the community of practice, and also some contacts going forward. Ali, I don't know if you want to add anything at this moment. If not, very happy to take any questions from colleagues here.
Hi, thank you. Yeah, so I've got Lisa Fisher as well. We're at the meeting with the LPC, so showing how well we integrate with each other, and Lisa's been brilliant at supporting those community pharmacists wanting to get on a course and also through the journey. So, and Lisa's going to be a DPP for the first time as well as coming up, so that's really positive. So we're just really wanting to incorporate the community pharmacists into this space and try and help support integration with the practices.
Yeah, really important, Helen, that you know, I'm really keen that community pharmacists work together collaboratively to develop, and it'd be really good for pharmacists and for the workforce. So yeah, fully behind this. Thank you.
Perfect. Absolutely. Could not agree more. And part of the thing we're doing at the moment is doing a particularly pharmacy specific mapping exercise. So if you are a pharmacist on the call, we are doing a similar thing to what Lily's done, but particular focus on pharmacy. So there's a questionnaire to fill out. Please, if you haven't done it, do so, or share it with pharmacy colleagues, because this will absolutely help in us understanding where our IPs are and DPPs are within general practice and community pharmacy. So thank you. Appreciate your time. I'll hand back to Kerry. Thank you.
That's all right. Thanks, Ellen. Thanks, everyone. Again, just another plug. If you can just pop some more things on the agenda on the poll that's in the chat function, that'd be really helpful, and we can share the cloud to understand what sort of that means. We've got 24 responses altogether, which is fantastic. A lot of them things I've got on here around practice development, scope of practice, professional development, best practice, current DPS, MA training. Is MA training, because that's a separate thing, so that's separate to this. Is that around updates? I'm just assuming that would be good just to understand. Licensing, trainees, annual updates. So there's lots of things that we were doing. So Alexandra, sorry, please do. You've got a question. Please do pop.
Yeah, thanks, Kerry. Yeah, I was the one that wrote about MA training. We basically we were aware that there hasn't been much in the way of BNSSG prescribing updates for a little while, just because of the changeover from AVEN LMC training. So we saw a flyer for the MA training and just kind of jumped on it really, as there's 3 nurse prescribers in the practice. So I was just wondering if anybody knew what that sort of covered, and does that count as enough kind of an annual update, or do we need more of a kind of update from BNSSG?
Yeah, so just a bit of background to this that people don't know. So there's funding on an annual basis that covers practice support training. It covers training for individuals within the practice. It's a national funded training that previously it went to LMC UK services that were part of AVEN LMC, and there was a procurement this year which went out, and MA Training are the company that won the procurement. So effectively what they have been asked to do is to deliver training, lots of different training, not just independent prescribing, but lots of different training for the practice. And they do their independent prescribing training is supposed to be enough for your annual update. Just consider your update really is not just a tick box. I would absolutely argue as well, is that you really need to make sure you understand what it is you're updating. So consider your scope of practice, consider what your learning needs are, and then identify what things you need to be updated. Because if you go to the MA training updates, they may not cover your scope of practice, because it's really hard to cover everyone's scope of practice. So I would say you can definitely go, and I think you should definitely attend, because it would be good for that. But I would also argue that you also need to consider what it is you need to update and look at your own individual scope of practice, just to ensure that you're keeping on top. Because you may be prescribing stuff for mental health, but you go to the MA training and they don't cover the updates from that. I think what we're trying to do with these sort of communities of practice is really think about as a system. We have lots of updates that come from the MedSop team. So is this a space that we can use that? And is that sufficient enough for you? So, for example, if there was something going on about diabetes and they wanted to do a diabetes update, could the person come to here and do the update? And if diabetes was an area that you needed to update on an annual basis, is it that you come to these sessions and that's part of your update planning? So I think that's really key, is to really make sure that you know what your learning needs are. And also the things around sort of de-prescribing. So we talk about prescribing, but we have to talk about de-prescribing as well. So I think that's really important. we've got remedy updates, but how do you access updates? Do you access newsletters or bulletins? What are you accessing to help your own learning and development? What are you doing within your PCN or even with your practice? Rachel's got here, update can be done in-house, as it can be specific to own learning needs, but also needs a group of practitioner needs. So it's really about being creative with your updates that fit what you want and what you need to ensure that you're a safe practitioner for the population that you are looking after. And I think that's really important. And then obviously the DPP and DPS and stuff. So there is a plethora of stuff out there that we will definitely try and bring to these sessions. We don't want to make them too long, hence the fact that we've reduced it to half an hour, because we feel that people can just nip in at their lunchtime and listen and learn. My other top tip would be to say is that you need to reflect on this session as well. So it's okay to come to these sessions, because I think that's really important to give you an update of what's happening. But I would also go away from these sessions and use them as a reflective tool that will form part of your portfolio of evidence and of learning, so that when you do your appraisals, or if CQC come in, or if anybody like that you've spent your time, if your manager say to you, we've given you half an hour to attend this session, what did you get from it? You can say, here you go. And that's just using your own reflective templates that you've got and the only stuff, the things that you have. So that's just a couple of things that I would suggest. I'm talking to myself as much as I'm talking to everyone else, in all honesty, because that's what I'm going to have to do. And I think that's really important. So, yeah, and it's also a place to share things. On the chat function, we've got health innovation, we've got the Stop Start toolkit. So there are so many things that I think that us as our collective mind, we could really build up a repository so that anyone who wants to do anything can do it. And also the other thing that I would suggest is, or my other ask would be, is there anything that you want to come and talk to this group about? So is there any really good practice that's happening within your PCN or within your practice regarding independent prescribing, whether it's a management thing to do with a policy, an appraisal, your own community of practice, or whether it's something to do with your own actual practice that you're doing. So what have you looked at? What have you changed? Have you done any quality improvement projects within your practice that have been really effective? Are there any challenges that you're getting with population that you're finding really tricky, that you want to, where do I get that information from, or how do I access services, or, how do I do things? So we really want this to be not a meeting of us telling you things. It really has to be a collective minds, because we're all responsible for our own development and our own learning. So if you want to talk, please come and please email us and say, I want to do something on this. It's very good for your portfolio, I have to say. It's very good of a reflective tool to prove that you've come and talked to everyone. So I think that's just really that's a good thing to do. Rach, I might be getting you to come to the next meeting. You're saying all this stuff about this in-house and group of practitioner needs. I think, Rachel, but I think you might have put your name down for things. I think you might be coming to the next session and telling us what you're doing within Mendip Val. So I know you'd love to do that. And also, don't forget, it's a community pharmacy thing. So I think for me, it's really important that we're involving the community pharmacy. So if you are working, you may have a community pharmacy that's linked with your practice. You may have some really good practice that happens between the two of you, whether it's to do with your prescribing, whether it's to do with your prescribing habits, or whether it's to do with your training. And I really want to bring that in of like that best practices of what's happening, because it's talking about, I know we talk about the art of the possible, but it's true. It's like, how do you do things? Is that something we can do? Because it could be that you just need to kind of go next door, knock on the door and speak to your community pharmacist and say, right, what can we do to help you? How can we work together? So I really promote that sort of engagement with your community pharmacist as well, because I think that's important, because they're going to be learning. They need to be upskilling as well. Now, I've talked plenty. Rachel, don't worry. I'll ignore your comments. You're definitely going to do something. And Roger's just put could Jane please confirm email for attendance list? So Jane, whoever's on the list, please just confirm your email. And there's a lot of good sort of things there. The bulletin, thanks Mary. There's a non-medical prescribing bulletin, which is a national one. Definitely sign up for it. It's really helpful. Got a bit about the Stop Start toolkit, so we can definitely do something on deprescribing. And the Health Innovation Network, yeah, we link with them as well. So if there's anything that we feel that we can link with and bring out, that's fantastic. Now, look, 3 minutes. Check me out. I'm doing it. I'm there. I'm just brilliant. I'm over it. Has anybody got any final questions? As I say, this is the inaugural meeting. The next meeting we'll try and come out. We will try and do them on a regular sort of monthly basis. It will probably stick at half an hour. It may go to 45 minutes, but I'm just trying to sort of make sure that we get enough people attendance. Marieka.
Yeah, I'm just wondering, so I have a look at all these links, but is the next meeting coming up? Because you said we had to vote, but we don't have time to look at that.
No, there's no, I'm not going to vote for a so basically we will, I need to sort of make sure that Helen's at the meetings, and I need to make sure that Mary's at the meetings, and we will create the dates. It will be a monthly meeting. We'll try and do them on a regular basis so everyone knows. We know that it's really hard to accommodate. What we've done is what the GPNs do is they alternate the days, don't they? So it's Monday, Tuesday, Wednesday. So we may try and look at that, just so that it gives people an opportunity to attend of the ones that aren't actually able to attend. We will definitely record the meetings. Very happy for you to sort of access them, and we will pop them on our website. We'll pop them on our website so that you have access to them as well, and the community pharmacy teams have access to them. So they will be there. They will be accessible, but we would definitely advocate for people to attend so we can share things together. Bear in mind, please do not share any personal details with regards to patients. That would be really helpful. And the other thing, just as a plea, is that it should be a positive environment that we can bring stuff, and I know it can be challenging. So we really need to make sure that we can progress with things, that we can move forward. So if there's any things you want to sort of talk about that are challenging, or any barriers that you want to talk about outside this meeting, please do come to us, and we're very happily talk to them outside of the meeting, just to make sure that we keep that sort of momentum going, and we can keep going with things.
So is there any quick website or something I can look at what they want you to do when you need to do your your audit?
Not at the minute, 'cause that's what Lily's doing. So Lily said she'll get something out before the end of the year.
Okay, sorry, I missed that bit.
No, that's fine, honey. So Lily's done the survey. She'll get something out to everyone by the end of the year. No pressure, Lily. And we will be sending you invites to the next meetings, and please do come along, and please do be proactive with it, because the more response we get, the more we can carry on with things. Roger.
Just a very quick reminder, I put a feedback form link in the chat, so really appreciate your feedback, please. Then we can shape these events going forward. Thank you.
Great, marvelous. Thank you, everyone. Look, past, I've made it. Have an amazing afternoon. If I don't see you before Christmas and Hanukkah, have an amazing Christmas, and I will see you at the next meeting. Take care, everyone. Bye-bye.